Good afternoon, everybody. Welcome. We're going to get started as you're joining. Welcome to our Advanced Prevention Practice Echo series. This is facilitated in coordination with the Ohio Center for Behavioral Health Prevention and Promotion and the Ohio Coaching and Mentoring Network. It's designed for Ohio's experienced behavioral health professionals. Welcome to the session. This is the fourth session in the series, and today's session is titled Empowering Conversations, Practical Skills for Addressing Mental, Emotional, and Behavioral Health. My name's Jen Morrell, and I'm delighted to lead the session today for Ohio's Project Echo Hub, which is dedicated to empowering the behavioral health prevention workforce. There are over 1,500 Echo Hubs worldwide that span more than 200 countries, and we're excited to introduce this model as a virtual resource and a vital resource for the behavioral health prevention community. Thank you all for being here with us today. The Echo Hub is housed at the Ohio Center of Excellence for Behavioral Health Prevention and Promotion, and we welcome you to visit our website where you can learn more about our work. The center is funded by the Ohio Department of Mental Health and Addiction Services and is administered by Ohio University's Voinovich School of Leadership and Public Service in partnership with the Pacific Institute for Research and Evaluation. If this is your first time at an Echo session, welcome. We are continually growing community, and we're so glad you're here. At the heart of Project Echo is the philosophy of all teach, all learn. And each session kicks off with a presentation from an expert on the topic, followed by a community member who shares their work and experiences. What makes Echo unique and effective is that everyone here brings their own knowledge and experience, and we'll have an opportunity to learn from one another during the discussion in the latter half of the session. On this slide, we're highlighting some of the key benefits of Echo. Notably, the model quickly democratizes access to information and expertise. That means that knowledge is shared equitably and ensures that everyone, no matter where you're located or what your professional network is, has access to the latest and best practices. Echo ultimately builds workforce capacity by empowering professionals across different sectors with skills and knowledge they need to make an impact. So some practical tips for today. Please mute your microphone if you're not speaking. And we understand that this is lunchtime, but if possible, please turn on your cameras. The sessions are intended to build connections and relationships with our colleagues. We encourage you to use the chat feature throughout the session, particularly if you want to share a relevant resource. And we are working to capture all of those resources listed, and then we post them in the iEcho platform immediately following the session. And then finally, please reach out to our talented colleague, Nancy Clough, if you are having any technology issues. Riley Jones is also available to help, and their email addresses are in the chat. So we have an incredible hub team that's responsible for preparing today's session and make sure that the series meets your needs. You can identify those hub team members on this call by looking for the white background and the Echo logo. As a hub team, we're committed to creating an inclusive environment and providing all necessary accommodations. We start on time and we end on time, and we work really hard to make good use of the time in between. The only recorded part of our sessions will be the didactic presentation, and that is out of respect for your privacy and the community members you serve. We also ask that our participants help us to create a safe and respectful learning environment by valuing the opinions of your colleagues, using inclusive language, and protecting the privacy of everyone involved by keeping discussions confidential. We encourage you to be open in sharing your experiences, knowing that this is a supportive space. Finally, I'd like to remind you about the schedule for our upcoming sessions. Continuing education credits are offered for each of our live sessions by completing the evaluation that will be in the chat at the end of the hour. So with that, I would like to introduce you to our co-presenters today, Carol Baden and Kathleen Davenport. Carol is a community health advisor with Recovery Ohio in the office of Governor Mike DeWine, and Kathleen is a regional business consultant with the Ohio Bureau of Workers' Compensation. Welcome to both of you. We are so grateful for your time and are excited to learn from you today.
Thank you, Jen. Hi, good afternoon. I'm Carol Baden, and I'm going to present materials to start off from Ohio Mental Health and Addiction Services. Next slide, please. First off, we'd just like to talk a little bit about addiction. Obviously, it is a disease that impacts the brain and other body symptoms. We know that it is a chronic or lifelong and a progressive disease. We know that relapse is often comparable to other chronic progressive diseases such as diabetes and heart disease. Next slide, please. We also know that most people do respond very well to treatment, yet less than 50% of people seek treatment for a mental health disorder, and less than 10% seek treatment for a substance use disorder. Do people get these diseases by choice? Absolutely not. Lifestyle, environmental factors, and genetics can all play a role in someone developing an addiction. Can they be controlled by medication and therapies? Of course they can, as do medications and therapies allow a person with another chronic relapsing disease, such as diabetes or hypertension, control their disease or disorder. As you can see, 23 million Americans seek treatment for substance use disorders, and only 10%, as we mentioned, actually get the treatment that they need. By contrast, 85% of the 29 million people who seek treatment for diabetes attain treatment for that disease. Next slide, please. So when it comes to outcomes, we obviously want to improve our outcomes for folks with SUDs and mental health challenges. We ask that you not wait until stage 4. We know that early intervention makes a difference. And we also know that stigma and isolation can keep people from getting the help that they need. A review of studies on stigma shows that while the public may accept the medical or genetic nature of a mental health disorder and the need for treatment, many people still have a negative view of those with a mental illness. Next slide, please. So we know that ongoing support and connection is meaningful and purposeful for people who have a substance use disorder or a mental health disorder. Why is work meaningful? It builds relationships, it builds life and job skills. And we know that we can provide treatment and support over and over again to an individual. And until they really find that purpose, that need to get up in the morning, take care of their family, take care of themselves, we continue to lose. We need to make sure that we are providing people with that purpose for themselves, their lives, their meaning. Next slide, please. I'm going to jump into the Recovery Ohio presentation today for Recovery Friendly Workplace. Next slide. So we know that this program helps employers to assist their employees with mental health or substance use disorders. We would like them to be able to expand and retain workforce and recruit workforce of folks who are in recovery. We want to highlight their status as a recovery-friendly business, as an employer. By removing many of the barriers and stigmas for individuals with mental health and substance use disorders, we can take the next steps to a purposeful well-being. We also know that maintaining connections in recovery is important. According to SAMHSA, a national survey on drug use and health, 22 million Americans are in recovery from a substance use disorder. Of those, 2/3 are employed. 80% of those 2/3 are full-time workers. In Ohio, we know that we have 5.5 million people in our total workforce. We are third in manufacturing employment in the nation, behind California and Texas, and we are the 9th largest exporter in the nation. And we also know that we have currently 88 Ohio employers who have signed up to be participants in the recovery-friendly workplace. I would be remiss if I did not mention some of the barriers to employment in our state. When we take a close look at 32 of Ohio's 88 counties that are considered Appalachia, their labor participation rate is 72%. The national rate is 78%. In these counties, we also have higher rates of disability, lower educational attainment, and a large share of physical jobs, a higher rate of substance use disorders and overdose. For people ages 25 to 54, that is much higher than the national or Ohio's overall average. Another factor in our workforce is the incarcerated population. In January of 2024, there were 44,900 incarcerated individuals in our state with an average age of 40.8. We really want our employers to think about second chance programs as well and expedited pardon as a means to help us increase our workforce. One of the third complications and barriers is stigma. We know that's one of the biggest barriers to people successfully attaining recovery. Evidence tells us that SUDs and mental health challenges are not a choice, but they are also not easily overcome. And sustaining recovery is no small undertaking. The Recovery Friendly Workplace Program is another tool in the tool belt to help people get into recovery and stay in recovery. We also know from studies that have been done that people in recovery provide a stable and reliable workforce. And data shows us they have lower rates of criminal behavior, reduced healthcare costs, and reduced workplace accidents. That makes a better bottom line for Ohio employers fiscally as well. Next slide, please. Why become an Ohio recovery-friendly workplace? We've covered a few items, but I would like to look at specifics when it comes to the fiscal benefits. Supporting employees in mental health challenges can reduce the average by $4,700 in costs associated with missed workdays per year. Each employee who recovers from a substance use disorder saves a company over $8,500. We know this is because of increased work days, upskilling, and overall well-being saved in healthcare costs. Workplace safety is also key, and we know that getting people into recovery and helping them stay in recovery improves our chances for good workplace safety marks. Next slide. Now to get into the program itself. When this program was developed for Ohio, we wanted to make sure that it was not only employee friendly, but employer friendly. We wanted to provide information to our employees on the importance of physical and mental health. I come from a health background in my career. I would love to see behavioral health elevated to the same level of importance as physical health for our employers across the state. Second is we offer details on how employees can seek help, including your employee assistance programs. This is very important to remember because even if you do not have an employee assistance program, it will help you. We can help you get connected to your local providers for treatment and support, and also trainings. The state offers a number of programs across the spectrum of prevention, treatment, and recovery in trainings and support for you and your employees. 988 is another fantastic resource. We all know that the thoughts and the worries and sometimes other issues that can creep in don't often happen on the 9 to 5 Monday through Friday workday. In the off hours, it's good to know that 988 provides a person on the other end of the line. It does not have to be a crisis. The third one is partner with a local recovery-focused organization. The inbox for Recovery Friendly Workplace comes directly to me, and I reply to each employer individually with resources. I stay in touch, and I do want to make sure that they are connected to local resource providers so that their employees have the best benefits available. Number 4 is to engage employees with recovery-friendly content. There are great modules for employers from the Ohio Chamber of Commerce and Jobs and Family Services. We also know through some trainings that we have done with partnerships of Addiction Policy Forum and Ohio Mental Health and Addiction Services, Encompass or responding to addiction trainings. I really like these modules because we actually have 2 sections in that training to help people have a difficult conversation with someone about substance use and mental health. I think this is invaluable for our HR and employer benefits. Next slide, please. These are just a few of the resources and campaigns that Recovery Ohio has worked on along the way. Naloxone.ohio.gov, you can go on, take a training, and get a free naloxone kit mailed directly to you. We have Recovery Within Reach. We have the Encompass and R2A, or Responding to Addiction trainings. We've worked closely with 988, Project Dawns across the state, and OH Against OD. This is just part of just a short list of the programs and initiatives that we have been involved in. Next slide, please. I've already made mention of the 988 line and the use of the naloxone. Just a quick story here. I did get a submission from a trucking middle manufacturing warehouse. Ask them, what prompted them to reach out to us. And the response was that they had had a positive drug screen just the week before. I got them immediately connected to their local provider. And we also talked about 988. And they have posted the 988 number in every one of their trucking bays. Next slide, please. Just a few sample materials that we also have available to support recovery-friendly workplaces. The Pledge to End Stigma, obviously, is on our website. And secondly is stigmatizing language. We developed a media toolkit that is useful to everyone to watch the language that they use around their employees. We absolutely want to be respectful and intentional when we are addressing the issues around recovery, substance use, and mental health challenges in the workplace. Next slide, please. We have a recovery-friendly workplace toolkit that was developed and gives immediate resources to our participants. They're listed on this slide: the flyer, press release template, newsletter articles, etc. Next slide, please. We would love for you and every employer across the state to join us in the Ohio Recovery Friendly Workplace designation. We hope that you would consider this and sharing the one-pager that's available on our website, which I will also share in a link in the chat. Thank you. Next slide. I'm going to turn it over to Kathleen. Thank you, Kathleen.
Thank you, Carol. So my name is Kathleen Davenport, and as stated before, I'm with the Ohio Bureau of Workers' Compensation. We are more than just an insurance company who pays out claims when injuries happen on the job. We also have that focus on prevention. Substance use can dramatically impact employee safety. So at Ohio BWC, we offer some programs to reduce workplace injuries, and one of them is called the Substance Use Recovery and Workplace Safety Program. We reimburse for the development and legal review of employer policies and procedures related to substance use issues. A strong drug-free workplace program can help employers reduce that substance misuse and lower their costs and increase productivity. It can also help employers create a more supportive workplace for people in recovery. We reimburse for drug testing for employers for their prospective or current employees, for those who offer a recovery-friendly second chance testing policies. So if you're testing policy indicates that you offer second chance, we will reimburse for the drug testing for individuals who are pre-employment or new hire or even post-accident reasonable suspicion. So drug testing can help people who are in recovery stay accountable. It can monitor their progress. It helps reduce the risk of relapse. It can really help employers create that safe and supportive workplace. We also reimburse for supervisor training and employee education. Supervisor training is important for managers who work with people in recovery because it helps them support those employees in recovery. It reduces that stigma and really improves retention of those employees. Educating employees about substance use disorders can also help reduce the stigma and improve retention and increase that productivity. It can also help employees in recovery manage their own triggers and maintain their own recovery. We rely on substance use professionals, like many of you on this call, to provide this training. Feel free to share information about our reimbursements to employers in your community and encourage them to contact us if they're interested in utilizing the fund. Employers can actually go back 1 year from the date of service, so 12 months from the date of request to make that submission. So if an employer applied for these funds today, they could actually go back to April 18th of 2024 to request any reimbursements. Next slide. So for an employer to be eligible, they basically just have to be in good standing with BWC. They do have to pay into the state insurance fund, meaning they can't be a self-insured employer with BWC. But most employers in the state actually do pay into the state insurance fund. But they have to be current on all payments due to BWC and in an active status with us to be eligible. So we do provide a drug-free safety program directory and list vendors who can assist employers on implementing a drug-free workplace program. We try to update this with current vendors who offer services. If you're a vendor and wish to apply to be in the directory, I'll put a link also in the chat with the application that takes you to our website that has the application, and you're able to provide that supporting documentation. So all vendors are required to be licensed and certified professionals with a concentration of drug and alcohol. So starting July 1st this year, we're slightly changing the name of the program to the Substance Use Prevention and Recovery Program. But also more exciting, on July 1st, we're going to expand the reimbursements to include substance use assessments for an employers with those second chance. So we're expanding the elements of what is included in the reimbursement. So with that, that ends my portion of the presentation. I'll turn it back to Jen.
Absolutely. Thank you both, Carol and Kathleen. I think the resources you shared, hopefully, I think is going to be very helpful to our audience today. I think we're all find ourselves in a situation where we have opportunities to address stigma and share those conversations that support mental, emotional, and behavioral health. So again, thank you for sharing. We are reaching the